So, one of the arguments we continue to hear about single payer healthcare is how expensive it is and how it's going to bankrupt the country. It's going to add an extra $30 trillion over 10 years onto the deficit. And we just can't afford it, right? So now here's the thing. In reality, our current healthcare system is incredibly unaffordable. Now, how can I make that distinction? What proof do I have? Well, we can just look to our northern neighbors, Canada. Now, according to a new study that had just come out earlier this month, Canada actually spends 4 times less than we do per capita on healthcare for every Canadian. So now, administrative healthcare workers, they said, and health insurance employees who play no direct role in providing patient healthcare actually end up costing every American man, woman, and child an average of about $2,500 per year. That same thing in Canada, the cost of administering healthcare is only about $551 per person. That's about a quarter as much. So healthcare in Canada, far cheaper to administer than here in the United States. So now this study was published a couple of weeks ago in the Annals of Internal Medicine. And basically, it challenges the assumptions about the efficiency of public and private healthcare programs. So now, right now, we've got a mishmash of private and public healthcare. For example, we've got Medicaid, which is a public system, which is means tested. But also, by the way, the Medicaid program also has a private component as they contract out to private contractors to be able to expend that insurance to people. Or to administrate that insurance to people. You also have, for example, just straight up private insurance. And you also have straight up government insurance through the VA, right? And so all of that together and the various subsidies and private options or private, plans, the supplementary plans that go along with it, well, they end up costing us a lot more money than if we were to just go to a pure government insurance system. And so that's hugely problematic here in the country. And that's why, of course, you have Bernie Sanders out there, who's the only candidate. And I know some people say, well, Elizabeth Warren says she's in favor of Medicare for all. I don't exactly believe it because her plans have kind of shown me otherwise. Releasing her healthcare plan and her transition plan, which calls for 2 different pieces of legislation. You have the one, which basically creates a public option, which is not at all like single payer. So I don't know how she can make the argument that, oh no, this is to get Americans used to a single payer system. Then they can just opt over. Well, I'm sorry, but under a public option, you would still have premiums, deductibles, and copays, right? Depending on how the system, you might just have premiums, which is not a single payer system because there are no premiums in single payer. And there are no, deductibles and there's no out-of-pocket cost at the point of service. And so that's very important. That is a big distinction between a public option and a true single payer government insurance plan. All right. So now, like I said, Elizabeth Warren's plan calls for the transition in her 3rd year in office when she's running for re-election after she spends all of her political capital trying to get a public option. So again, I don't see her path as realistic. Certainly less realistic than making one all-out push for Medicare for all and getting it done, spending all that political capital and fighting that fight. All right. So anyway, now what's important to note about single payer in Canada, right? They've had it since the 60s. So they've had this for a very long time. And so they know how the system works. Now, in the system, Canadians don't get healthcare bills. They don't fear losing healthcare coverage if they change jobs or get fired or their employers change plans, or if they make too much to qualify for Medicaid, or if they can't afford their insurance, private insurance premiums, Maybe their Obamacare subsidy didn't come through, or maybe they make too much for it or too little for it or whatever. You're like, because there are people that are in the situation where they make too much for Medicaid, but not enough for the subsidy, which is very strange, a strange place to be. So there's that situation, right? None of those situations happen in Canada. And so I just want to point that out. Their system is so different than ours. Now, that doesn't mean that there's no problems with a single payer system, as we're going to see from attack ads, but those ads are generally overstating the issues. Yes, there are, waiting times for specialist care and some diagnostic imaging, like you want to get an x-ray in your leg. Well, that might take a little bit longer to schedule an x-ray. At the same time, we all know that happens here too. It's not as if like, oh no, if you have the money, then you call your doctor and you can get an image scheduled for like tomorrow at noon. No, that's not what happens. Generally, and at least in my experience, generally that tends to take, if I wanted to see my doctor and I call them up and set up an appointment, it's usually a good 2 to 3 weeks, possibly a month later that I can see my doctor. That's have insurance, have the money. That's crazy. That is a long waiting time. And more so, again, if you want to see a specialist here in the United States, it can take upwards to 6 months. And that's without a single payer healthcare system. And so there is that issue that exists in our healthcare as well. And so, look, we also have supplementary plans. Canada also has supplementary plans because Canada doesn't cover things like dental or vision as well. Oh, I'm not sure about vision, let's be honest, but they don't cover dental. And so there's that issue as well. And there's outpatient medications that are not included in the government plan. But aside from that, most of the things are covered by the Canadian healthcare system. Bernie Sanders' plan would actually be more comprehensive than the Canadian plan. It would actually be better. In fact, there's a lot of Republicans, Democrats, Freudian slip there. There's a lot of Democrats who are against single payer who admit, I believe it was Michael Bennett, who said, oh no, single payer would be the Cadillac plan. Vision, dental, reproductive services, a lot of extra stuff is put into Bernie Sanders' Medicare for All plan because its aim is to be as comprehensive as possible and to not need any sort of supplementary health care or health insurance. It would eliminate the need for health insurance companies. And so that's really important. So now, the cost of administering this healthcare system amounts to just about 17% of Canada's national expenditures on health. So you actually have very low administrative costs. However, it's certainly lower than private health insurance. Now, in America, Medicare is actually lower than that. Just to administer Medicare, it is very efficient. So now, in the United States, however, taken all together, it costs about 34%. It costs twice as much. 34% goes to salaries, marketing budgets, computers of healthcare administrators in hospitals, nursing homes, and private practices. It also goes to executive pay packages, which for 5 major healthcare insurers reach close to about $20 million or more per year. And it goes to rising profits demanded by shareholders. So that's just the administration. So there is a problem. And Meadow Bailey says, we do cover dental now. So, and that's in Canada. Wasn't entirely sure, but thank you for that clarification. Now, administering the network of public and private healthcare costs is an estimated $812 billion per year in the United States. And in 2018, 27.9 million Americans still had no health insurance. They were uninsured because mainly cost. And so that's, again, a huge problem. Now, according to the study authors, the U.S.-Canada disparity in administration is clearly large and growing. And they said discussions of health reform in the United States should consider whether $812 billion devoted annually to health insurance administration is money well spent. Well, it appears to not be, because again, it's going, as they point out, into shareholder profits and advertising budgets. That doesn't go to your healthcare. That doesn't take care of anything that you need. These are people completely unrelated to your healthcare needs that are getting your money and that are getting taxpayer money. And so that is a huge, huge problem. So now they base these costs, in case you're wondering, on an analysis of public documents filed by insurance companies, hospitals, nursing homes, home care and hospice agencies, physicians' offices. Researchers from Hunter College, Harvard Medical School, and the University of Ottawa compared those to administrative costs across the Canadian healthcare sector, as detailed by the Canadian Institute for Health Information and a trade association that represents Canada's private insurers. I bet, too, that the information on Canada was probably a lot easier to get. Instead of having to hunt down, of course, all these different other sources in order to get your data, you just have the health insurance companies in Canada, which are a smaller sector, and then the Canadian Institute for Health. Makes sense. Now, the last time they did this comparison, by the way, was back in 1999. Now, they note that the costs of administering healthcare insurance have grown in both countries, which, again, makes sense. You look at inflation. But they note that the increase has been much steeper in the United States, where a growing number, they say, of public insurance programs have increased their reliance on commercial insurers to manage government programs such as Medicare and Medicaid. And so that's what I was talking about earlier with Medicare, Medicaid specifically, contracting out to actual private insurance companies to administer their plans. And we see it here in Michigan. Now, as a result, they say, expectedly, that overhead charges by private insurers had surged more than any other category of expenditure. Again, we're not shocked about this. We shouldn't be surprised, right? Now, when you compare it to the states, and again, not every state contracts their Medicaid out to private companies to administer that healthcare or that health insurance, but in states that have retained full control over their Medicaid programs, again, no surprise, the growth of administrative costs was negligible. And of course, when you compare it to Canada, the same can be said about the Canadian system. There was basically no growth or very, very little growth in healthcare expenditures for administration. Because, of course, right? In states that shifted their Medicaid recipients into private managed administration, managed care, administrative costs were twice as high. So there's a lot of waste in our system right now. So, and that is because you have a private profit motive. Now, the study's authors said that if we wanted to fix that, we could trim the administrative bloat to bring it in line with Canada's healthcare. And if we did that, we could save $628 billion a year for the same healthcare. In fact, they said the United States is currently wasting at least $600 billion on healthcare paperwork, money that could be saved by going towards a simple Medicare for all system. Now, this is according to senior author Dr. Stephanie Woolhandler, right? Now, that sum, she said, would be more than enough to extend coverage to the nation's uninsured. And we don't do that because the for-profit insurance companies lobby our politicians. And so not only do they lobby politicians like Pete Buttigieg, who wants to keep the system the same and has gotten a lot of money from healthcare companies, but they also lobby people like Joe Biden and they give them a lot of money, and they gave Obama a lot of money to not make any major changes to our healthcare system. And so this is what we're facing. We're facing a corrupt establishment that gets money from private special interests so that we as citizens can either not be able to afford insurance or spend 4 times as much as the closest country to us with single payer. No. We've got to fight against the special interests, and we have to enact single payer now. And the only way that we're going to get there is if we nominate and elect Senator Bernie Sanders to be president. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a patreon.com/TYTNation set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent progressive media.